Good evening, everyone. This is Dr. Himani Narula. I'm a developmental pediatrician. And yet again, we are back with our question and answer session. A lot of parents had put up questions on the Google link that we had shared. And today we'll try and take up most of the questions that you had asked us. Similar questions we have clubbed together so that we can answer most of the parents. So let's start our Q&A sessions for today. So let's have the first question. So first question was asked for the child, Arzan Patel. He's 2 years, 11 months old with mild autism traits and ADHD. So the child is already undergoing some therapies in the form of occupational therapy and speech therapy under a neurologist treatment. And the question parent is asking is, I have read a recent study which mentions metformin to be used in dealing with autism symptoms like social communication. How much does it help? How to give tablets to such a small child if not to be given with honey? Okay, so something which is still under research and has not yet been put up as a standard treatment guideline needs to be used under supervision of your doctor or the neurologist. If your neurologist is recommending a medication, they will probably recommend the same with a scientific data and background. So any treatment which is having enough scientific evidence should only be used for treating children with any neurodevelopmental disorders. Till then, we must stick to the standard treatment methods like undergoing therapy sessions, because all the other medications, any medications for that matter, if we try, can have their own side effects. So it's important that we stick to the standard treatment guidelines, and without the recommendation of your doctor, neurologist, or your developmental pediatrician, we would not support use of any kind of medications which are not included in standard practice guidelines. So let's move to the second question. The second question is for Ihan. Ihan is 3 years with autism spectrum. He is undergoing therapies like occupational and speech therapy. Why is Ihan pinching all the time? So, pinching is a behavior which typically occurs when the child wants to communicate and is not able to communicate with the other person, and that leads to some amount of frustration. The second reason could be that the child wants to be with the peer or wants to play with them, wants to express or touch the other person, but doesn't really know how to initiate a social response or interaction with the other person. That's the time when the child may start pinching to get the other person's attention. So we must try and figure out what is the reason. Is the child not having adequate words, vocabulary, or language to initiate a interaction? Then we need to work at building those skills so that the pinching and the hitting behavior reduces. And every time the child pinches, if that has turned into a behavior, a fixated pattern, even if the child we do not really know, then you can do an ABC for a behavior like pinching. You find out what are the times when the pinching increases, what happens before the child pinches, what is happening exactly. Is he trying to say something, communicate something, or is something troubling? Is it some kind of a tantrum where the child's wish is not being fulfilled, that he's trying to communicate by pinching, or is trying to get his things done through this method? So we need to find out what is the antecedent when pinching happens, and then consequence how you are managing. Are you every time telling the child, no, don't do this? So every time we use word like no, don't do this, we somewhere reinforce the fact, and the child tends to continue to do the behavior, and the behavior increases. So we may distract the child, we may divert the child, we may just uh, ignore the fact and move simply take the child's attention to some other interesting activity, and or help them communicate in a better and a more acceptable way, instead of just saying no, don't do it, right? So all these methods can be followed to reduce pinching behavior. And let's go on to the next question, which is for Ayan Khatri. He's 4 years and 5 months, has mild autism, and he's also undergoing occupational speech therapy and special education. So the question is, there's no speech, no bubbling, any word is my big concern. So yes, this is indeed a concern because the child is already 4 years and 5 months. I hope that a hearing assessment has been done for Ayan, because it's very important that the hearing is intact for the language to develop. So it's important that a hearing evaluation is done, and we know and we are well aware that the child can hear all sounds at all frequencies, which is expected. And then we also need to look at how is the oromotor system like. Is the oromotor system enough activated? Is the child able to move his tongue in every direction? And is the child creating any sound, ma, ba, pa, or is just not saying anything? Or is the child saying certain words in certain situations but not using it purposefully and meaningfully? So since you have written there's no speech, no bubbling, I would strongly recommend that you continue speech language therapy. There is something called as oromotor stimulation, which can be incorporated in the therapy by your occupational and speech therapists to stimulate the oromotor system, and continue with stimulation. Very rarely, some children on autism can be uh, uh, may not acquire speech, or they can have some kind of an apraxia associated, which can lead to delayed in the production of speech. There, if the child is not able to communicate and is showing other features, after a good trial of speech language stimulation, if the child still doesn't speak, then we can take help of picture exchange methods, and there are assistive devices to teach the child communication, which we can incorporate in the training program or in the therapy sessions. I hope that helps. So our next question is by Abhinandan. He's 3 years old, and he's also diagnosed with autism spectrum, and he's also undergoing therapies like occupational and speech therapy. His question is, my baby's tantrums are increasing. He improved a lot. I started therapies at home from 18 months for him, and he started talking in two phrase words. Now he understands my commands, but suddenly he becomes aggressive. Okay. So at 3 years of age, it is physiological for children to have some temper tantrums. It's normal. Most children in this age, they throw temper tantrum because they want to be more autonomous. They want to do things by themselves. They want their wishes to be fulfilled. So I think if your child is having a little temper tantrums there, do not get worried, because most children have these tantrums at this age group. And that means he's coherent and he's understanding the fact that I want my wishes to be fulfilled. But if the tantrum goes way beyond control and turns into a meltdown, or they are too frequent, or they are disturbing the child's acquisition of various skills, that's the time when we need to intervene and work at reducing these tantrums. Since he's able to use two word phrases to communicate and he understands commands, you need to find out what are the point and times when he becomes aggressive. Is it simply the time when you're not fulfilling their wishes? Then the tantrum again has to be managed in the same way. You can distract. A 3-year old can very easily be distracted. Divert them, involve them in something which is more interesting for them, instead of saying or using no, don't do this, or using language which demotivates them or frustrates them even further. So that ways you can reduce it, and decide in your mind whether you want to give something or you don't want to give. After a child throws a tempered tantrum, and after 15 minutes of his crying, you give in and you give that thing to the child, then you are reinforcing the tantrum. So you need to pre-decide what you want to do. If you don't intend to give that thing, then you are not going to give it, at least that day. Then the tantrums will gradually reduce if you work like that. Going on to the next question. So child's name is Umesh. He's 3 years old, and he was diagnosed with senseless mind disturbs. So, well, these are not the diagnoses, and these are not appropriate words that we would use for any child. But yes, he's getting treatment and also therapy in local area, and she's improving in action only. Okay. So it's a good thing that whatever facility and area you are able to get some therapies, and the child is also improving. But the most important thing is get a detailed development assessment for Umesh so that we know the child's developmental status and we know what all interventions are going to help. If you do not have access to interventions, then you can reach out to us through an online method. We'll do an assessment and we'll guide you through what all interventions can be planned and thought of for the child. So this method can provide you a more structured support, and then you can continue to work with your child at home as well and with local set of therapists who are available and close to your place. Next question. Going on to the next question. Can we have the next question, please? Yeah, so the next question is by Preetham, and the child is 4 years here and has ADHD and speech delay. He's taking Sizardone 1/4 and Arkamine 1/4 since 2 years and speech therapy since 6 months. Question is, he's hyperactive, non-verbal, not responding to his name, his hearing is normal. Okay, so if the child is hearing is normal and the child is non-verbal, then and but hyperactive, then I would suggest that you need to go again dig into the diagnosis. We must do a reevaluation and find out what is the cause for child not speaking, because typically a child on ADHD would speak. They do not have speech delays, or they may have speech delays, but they will be verbal, and most of them are verbal. So about the medications, yes, you need to discuss with your doctor or whoever, the neurologist or developmental pediatrician that you are following up with. They need to take a call on whether the medication dose can be increased or decreased, or for how long it has to be continued. About the therapies do need to continue, but a follow up or a detailed development assessment will definitely help, because then we will know what is the exact diagnosis which is causing a speech delay to the extent that child is still not become verbal and not responding to his name. So hyperactivity needs to be reduced there with the help of therapy. Maybe change of some therapy or adding some therapies would further help the child. So I would suggest a reevaluation and detailed assessment once again, because it's already been 6 months that the child is on medication. So we must perform that to plan the further course of action. Going on to the next question, we have Gaurav Suri, who's 2 years plus, not diagnosed, no therapies, and the question is speech delay. So, a child who's 2 years plus, speech delay is a very a common concern which is observed by parents, but at the same time, we must rule out if there are any features suggestive of social delay or delay in social reciprocal behavior. And is the child, if the child is not speaking, is the child able to communicate through gestures, which means non-verbal communication, like using index finger to point at things that this is what I want, giving joint attention, a combined attention at the object and then back at the person, and then being able to give a smile back, making an eye contact, understanding our gestures. If we are saying, the child will understand that telling me to be quiet. So these kinds of gestures the child will understand, follow. They'll follow our expressions, they follow our directions. We are pointing, okay, go and get that ball, the child will get the ball. So all these other red flags in their development must be looked into. A developmental screening again can tell us whether it is simply a speech delay or there are any other developmental domains which are lacking behind. Based on that, we plan the course of intervention. And also, a hearing evaluation is a must when the child has speech delay, to find out that hearing issues or hearing impairments are not a cause for speech delay, because those are treatable. And the earlier they are detected and the earlier they are treated, the better is the language outcomes for the children. Moving on to our next question. Okay, there's a lengthy question here for us from Ayansh. Ayansh is 3 years old and diagnosed with autism. He's taken early intervention program for 6 months, including OT, speech, and special education. He started going to play school from last 1 month. He tries to engage with kid and also participates in activities, but it is difficult to engage him at home as he doesn't follow the instructions and the repetitive things. Also speaks very less words but sings songs and rhymes on his own as is having sensory issues. I'm a working mother. Please suggest how can I help him to improve with home plan, or should I continue uh, to be with school and therapies? So uh, that's the first thing is that I would like to congratulate you that that 6 months of early intervention has really shown and help your child improve significantly, where he's able to go and sit in the classroom or maybe engage a little and is comfortable in a school environment, and he's engaging with other kids, he's participating in activities. That is a huge improvement, I would say. But as far as if the child is following instructions in the school class where there's a group of children and is not following at home, then maybe there's something that we are not doing right. So we need to keep the child motivated whenever we are working with a child at home. Motivation is extremely important. Dedicated time and schedule for the day is very important, so that the child knows that this is the time when I have to sit with my mom and do certain set of activities. However, if there are some sensory concerns which are still existing, then therapist can help, because they can do a sensory profile and evaluation, and then maybe help you with a home program of various sensory activities which will help the child balance sensorily and then be more regulated to learn in other domains. That can be attempted. I would suggest do not discontinue your support of therapies. Continue with school, continue with little intermittent therapies for the child, and learn how to work with your child at home simultaneously. So putting everything together, you will be able to bring a significant change further in their development. I hope that helps. So our next question is, a child is here 3.1 years, and there's no diagnosis as yet. Therapies are going on like OT speech, ABA special education. How to handle tantrums? Well, I have already spoken on how to handle tantrums. You can also refer to our videos. We have separate small YouTube videos on how to manage tantrums in detail and what tantrums are. So again, briefly, I would say just distract your child, find out the cause of the tantrum. And 3 years is a age where temper tantrums physiologically are emerging and appearing in children. And also here I would like to comment that if there is no diagnosis, get a thorough detailed development assessment done with a developmental pediatrician or your doctor, so that you have a correct diagnosis and a prognosis as to for how long we need to continue therapy and how much has the therapy helped till date. Moving on to our next question, we have Palvit Yadav. He's 4.6 years old, again diagnosed with autism spectrum, and therapies are going on. I'm so glad that most of the parents here are saying we are taking therapies and we are our children are showing improvement, and they are coming up with questions. This is really involved and uh, parenting, and I'm very glad about that. So here the question is, my child's stubbornness is increasing with age and shows tantrum while introducing task at home. Okay, so the child is stubborn, and stubbornness is more, and that is probably more at home than in the therapy areas, because in therapy areas I believe the child is doing everything, but you're facing challenge at home. So here again you need to figure out, is the child really motivated, uh, and add some reinforcers, because if the child is not motivated to do an activity with you, the child will be stubborn that I don't want to do. I did this today morning in the session, and now you're making me do the same activity at home again. So the child sometimes is not motivated enough. But if you change the way, sing a song, get more involved, do some physical jumping activities before starting the class, and alleviating the whole therapy area and the mood of the child, have few reinforcers ready at hand to reinforce the moment the child attempts an activity. The reinforcer motivates the child further to perform that particular task that you are trying to work with the child. Don't give up on the first day. Don't feel like the child is not doing anything on the first day, but keep attempting and have a fixed time for doing this activity with your child, because the schedule helps the child to prepare them emotionally and mentally. Okay, this is the time when I have to sit on a table chair and work with my parent or my caregiver. So all these things will help you work with your child in a better way at home as well. Okay, now moving ahead to our next question here. Uh, Next question is for Naksh. She's 3 years on autism spectrum and is undergoing occupational speech therapy. We are taking medicine for last 1 year, but no improvement. Instructions oblique commands not following, and understanding issues and teeth grinding. Okay, so I believe if the medications are not helping, you may go back to the doctor and speak to them and inform them that there's little change, so that the doctor can either reduce, stop, and however they want to take the call in reducing and stopping the medication, they can take a call. Or if they need to change some medication, that also can be considered. A detailed history is definitely required before a medication is started or stopped, or for how long the medication is taken, their doses, everything is important, and what are the contents of those medications. So I would suggest get back to your doctor and ask for an opinion that if your child is not showing improvement on those medications, do we really need to continue or we can discontinue them, and what is the method how you would discontinue. As far as the therapies are concerned, they must help the child. About teeth grinding, we must find out whether the child, we must rule out certain medical causes like anemia or worms, because children, they tend to put a lot of things in the mouth. Sometimes deworming and correcting anemia can also reduce teeth grinding. Sometimes it could be purely frustration related. It could be, we have to find out the cause. But if there is a medical cause, it definitely can be treated. But if there is a behavioral reason, then you need to do the ABC of every behavior and then plan the action, right? So that part can be discussed with the doctor, as to, or a behavioral interventionist who can tell you what all are the antecedent for that particular behavior, and how we can change the behavior, or how we can change the consequence, so that the behavior reduces. Going on to the next question. This is by Nabhya. She's 3.4 years, diagnosed with autism spectrum and is undergoing home therapy. Here, the parent is trying to ask that the child speaks and understand all his needs, tell things by speaking, but does not see in front with eye contact. So यहाँ पे ये कह रहे हैं कि eye contact कम है बच्चे का, और अटेंशन कम दे रहा है, और इसके कारण उसका डेवलपमेंट लैंग्वेज का जो है वो काफ़ी स्लो है, और एकेडमिक्स का डेवलपमेंट भी काफ़ी स्लो है, और इसकी रीजनिंग एबिलिटी, बट पेरेंट ये भी ऑब्जर्व करें कि इसकी जो रीजनिंग एबिलिटी है वो अपने उम्र से उनको ज़्यादा लगती है, एंड they are trying more and more to build his attention span so that he can learn better. So here I would want to say that attention span can be, you are doing a great job, first of all, that you're trying to work on the attention span of the child, but a detailed assessment would actually tell us how, what is the cognitive status or problem solving ability या cognitive development of a child. सो अगर आप असेसमेंट कराएंगे एक डिटेल, तो उससे हमें पता चल जाएगा कि बच्चे का कॉग्निटिव इंटेलिजेंस या प्रॉब्लम सॉल्विंग एबिलिटी किस लेवल पे है. 3.4 इयर्स के लेवल पे है, उससे ज्यादा है कि कम है. दैट हेल्प्स द अस टू प्रोग्नोस्टिकेट कि ये बच्चा बहुत अच्छा सीख सकता है, या ये बच्चे को इतना समय लगेगा सीखने में. सो दैट काइंड ऑफ एन असेसमेंट कैन हेल्प वन. दूसरा, होम थेरेपी आप कर रहे हैं तो आप थेरेपिस्ट से गाइडेंस ले सकते हैं अबाउट द एक्टिविटीज, because whatever activities, like if you are trying to teach them, okay, this is a pen, so then you need to bring that object in front of your eyes, and you have to call the child's name again and again, make sure that the child looks at you, maybe sing a song, so that the child, you get your child's attention at your face. The child needs to look at your face when you are working with any toy or any game with your child. The more the child looks at you, the more will be the chances for the child टू मेक एन आई कॉन्टैक्ट बनाने के लिए उनको आपके आई लेवल पे आना पड़ेगा, देखना पड़ेगा जो ऑब्जेक्ट आप दिखाना चाह रहे हैं, कोई पजल का पीस है या फ्लैश कार्ड है, उसको आंख के लेवल पे रख के दिखाइए और उनको दिखा दिखा के उसको ऐसे छुपा सकते हैं और बोल सकते हैं एप्पल, और ऐसे दिखा के आप बोल सकते हो पेन कहाँ गया, hidden, and then you again show that ways the child will try to maintain an eye contact, and repeating these kinds of activities and exercises can gradually improve their eye contact. उनके एज के अनुसार आप पजल्स एंड एक्टिविटीज लेके उनके साथ हर दिन बैठिए ताकि धीरे धीरे 5 से 10, 10 से 15 मिनट उनका अटेंशन स्पैन इंक्रीज होना शुरू होगा. This will help. Assessment and a home plan based on the evaluation of a child can help कि क्या क्या एक्टिविटीज कराना है. So that you must go for. Going on to the next question here is by Shriyansh. He's 2 years with ASD and ADHD and is undergoing OT and speech therapy. Now the question: if my child tights his whole body for 1 to 2 seconds, just concentrate on one thing. Is this a type of a seizure? EEG was found abnormal with multifocal, medium and high amplitude sharp waves and sharp slow waves over the right frontotemporal region with focal features with occasional subcortical spread, and MRI is normal. So here I would strongly recommend, if the child has got an abnormal EG, please carry your EG and report both the documents to a trained pediatric neurologist who can read the EG and be able to tell you how significant are the abnormalities noticed. And those 1 to 2 minutes of whole body getting tight, and while the child is tightening his body, a small video clip can be clicked for the doctor to observe, because a lot of times the neurologists, they do not the child does not show that behavior or seizure in front of the doctor. So a recording can really help to identify if that is actually a seizure or not. Other way to differentiate is if the child is non-responsive during those few seconds when the body is tight. That also is a cue that it could be a seizure. So here I would suggest that you visit a pediatric neurologist with all your reports, and then if need be, looking at the EG, they will decide if these abnormalities are significant and need treatment. Then the appropriate medications can be added. Going on to our next question here. The next question is for Isa Ali, 2.5 years. She's not undergoing any therapies as yet, but it will be started in June. The question is: there's no speech, screams a lot, and has hand flapping. So here I would suggest that get a detailed assessment. Every child must undergo a development assessment followed by assessment by the therapist, so that we know, one, developmental status of the child, two, the correct diagnosis of a child, third, the severity of the diagnosis or condition, and then the therapist will do their individualized evaluation also. Occupational therapist will look at what all are the skills that the child is able to do appropriately and what are lacking, and they will then squeeze out activities to teach them those skills that they haven't acquired age appropriate. Similarly, speech language therapist will do an evaluation, find out a receptive and expressive language aid, and from that level then they plan the course of action. Okay, this is what we need to teach first, and then the next one. So assessment is extremely important. Start with assessment, get a diagnosis, get a assessment by individual therapist also, and then interventions to be done to help the child. And simultaneously, as parents, train yourself, because it's always a joint effort by the therapist and parents. So getting yourself trained and learning yourself what has to be done can really help the child learn faster. So we'll go on to the next one here. Again, the child is Rijit Mondal, 4 years, on autism and is undergoing occupational therapy. Here, the question is: my child is not doing response in calling first and second times. How will it improve? So autism spectrum, we all know, they have poor name call response as one of their symptoms. They are so preoccupied in their own world that when you call them out, they even if their hearing is okay, they do not respond to the call. So here, whenever you are playing with the child, you can call them with their name. If his name is Rigid, then you call as Rigid. Whatever is the child's name, you need to use the name often while interacting with the child, instead of using a pet name like Golu, Baby, Shona. Instead of using these multiple names that you give out of love, use the name that the child has. Once the child starts hearing that word more often during the day, the child will start processing the word that, okay, whenever this word is spoken, I am expected to look and I am expected to turn around and respond. So maybe out of 10, if the child is responding 2 times now, gradually the response will start increasing to 6, 7, 8 times. But you need to do the if you are giving a bath, okay, you can say, Rigid, it's time for a bath. It's time, Rigid, let's rub your nose, or let's rub the soap on your tummy. So आप कई सारे words introduce कर सकते हैं, and simultaneously every sentence you start with their name. And every time you are playing, Rigid, get me this. Rigid, can you put it inside? So using it often can increase the call response. Going on to our next question here, we have, do we have more questions? Yeah, we have more. So we have more question. Anishka is asking, she's 7 years old, diagnosed with autism, undergoing ABA therapy. Question is, my child has been suffering from autism, uh, and speech has come, but some issues still exist. Even after taking therapies from so many years, she hit kids of her age since she was 3 years of age, and now she's 7. But still, her hitting is not going. Tried every possible. Can you suggest something? So we here must find out what are the factors which are causing hitting. Are we hitting the child at home? The first and the most important thing is, sometimes they just simply learn from us. If the parent is hitting the child to discipline the child, then that's not appropriate. We need to stop doing that. That's the first step, because the child now has learned that, okay, if anything is not happening according to my way, I can get it done by hitting. So that we need to change first, if at all it is happening. The second thing here would be that it could be as a result of frustration. Maybe every time the child hits, the response that we give is intense, and we are screaming, or we are doing something that is motivating the child to hit again. Either the child is enjoying the response or is trying to seek your attention. So all those, we need to sit and study what all are the times when the child is hitting excessively. And then if there are other sensory disturbance which are keeping the child disturbed and the child is restless because of some reason, then we need to correct those. Also, we need to do a physical examination to see कि कोई deficiency तो नहीं है. अगर कोई न्यूट्रिशनल डेफिशिएंसी है तो भी बच्चा इरिटेटेड रहता है, एनीमिया है तो इरिटेबल रहेगा. So we need to correct those, and that can help reduce all those behaviors when we work on all the areas. If the child is having constipated, तो उसका headache होता रहेगा, and the child will not be happy because he's gassy all the time, uncomfortable. थोड़ा भी किसी ने कुछ touch किया, they don't like the touch, they'll tuck से hit. So we need to work on all domains. It has to be a holistic approach, not just behavioral approach here. So that's how I would recommend that you can work with your child or seek help from a professional there. Moving on to our next question. Oh, that's a big one, a huge question we have from Koshi, 3 years plus with global developmental delay. What help or therapy does my child need, because she doesn't respond to her name, she doesn't maintain eye contact, and suddenly have meltdown, doesn't understand simple words. Okay, she doesn't understand things when can count, numbers, knows colors, food, animals. Okay, again, I would here suggest that get an assessment done where a child knows so many things. A 3-year-old child knows so many things. Maybe that the cognitive area is not that delayed, and then the child may not fit into a classic GDD diagnosis. So we must do a thorough development assessment and find out whether it's GDD or something else. If it is GDD or any other developmental delay, any other developmental disorder leading to delay, in both the situations, we need to work at building some amount of social and communication skills, because if the child can identify so many things, then definitely the child can start following small sentences. And you need to work at reducing the screen time, because they simply learn and have good rote memory. So whatever the cartoon is saying and behaving like, they will also behave like that. Instead, they need to look at humans more than the cartoon. So you need to somewhere put a full stop to the screen time for few months till the child catches up developmentally. Moving on to our next question. uh, if we have, yeah, we have Vivan Garg, 4 years with ADHD. And question is, after completion of therapy, does hyperactive and other symptoms reoccur later in life? So it's important for us to understand that a child who's having ADHD, as they grow, their hyperactivity tends to reduce with increasing age. But there are other two symptoms like inattention and impulsivity can persist. They can continue to persist. However, if a child the prevalence says that in early years there can be 15% children, 10 to 15%, there's a range of children who can have ADHD symptoms, and by the time they're adolescent, they reach their adolescent or adult hood, adolescent, it goes down to less than 5%, somewhere close to 5%, and by the time they're adult, the ADHD is 2%. So somewhere the symptoms are getting reduced, they are getting better, they are able to accommodate with their hyperactivity in their routines. Hyperactivity, as I said, will subside with increasing age, but inattention and impulsivity can persist. That's why behavioral regulation therapies in early years can set the neuronal patterns right, and they can help. But if the child continues to have symptoms, ADHD is one developmental disorder which can be treated with medications and psychological counseling and therapy, behavior therapy. So combination of all these can help. So I guess if the child doesn't improve, maybe after 6 months, till 6 months you try therapies. After 6 months, we may evaluate the child again and then consider medications if the child continues to be on ADHD spectrum. Going on to the next one, we have 3.9 years, Rice, having sensory processing disorder, speech delay, developmental delay, hyperactivity. So there's no proper diagnosis, I would suggest here. And I would request you to again go for a thorough assessment, because we must have a diagnosis. We do have concerns, but let's have a diagnostic evaluation here. Speech and occupational therapies is going on, and the child question here is how to help child memorize old and future incident. Okay. Can I give camoline herbal tea to drink for my 3-year-old at evening for early sleeping and reducing hyperactiveness? Already I'm giving some syrups, and okay, there's so many things that you're already giving. So about the camoline herbal tea and all these substances, I would not be able to comment because there's no research evidence. So this is not a scientific method. However, you can try some massages, calming strategies to calm the child at bedtime, switching off the light, putting on some calming music, giving some massages, or maybe a warm water bath before the bedtime can really help with good sleep. And if the child sleeps well, then definitely the child is much more alert and attentive the following day to learn. And continue with your therapies, because that also helps in reducing the hyperactivity. So going on to our next question, I believe this is the last one, which says, "Hi, ma'am. After starting therapies, how much time should we continue the therapies for holistic development?" So therapies are to support the child with their development, and we need to continue the therapy till the time that the child reaches to their developmentally age appropriate level. We have to support them to help them reach to their developmentally age appropriate level. And the best thing is when the therapies are going on for the child parents can learn, participate, because that helps them to sustain those kinds of efforts at home and can sustain it for a longer time, because the child would need support for a long time. Most of the time, with all these developmental concerns, they need long term support. So get yourself also trained while you are taking therapies in the therapy center, and try and do that at home, and that will double the effort and improve the pace of improvement for the child. I think that, oh, we have more questions. That's exhausting me today, huh? But I'm glad that there's so much of interaction we have had. So, our next question is by Ami Thakkar. My 8-year-old autistic child sometimes in a day got meltdown and start hitting me. I try to calm him by Om mantra, but did not work. What to do? Okay. My child is diagnosed with autism. We have been giving her therapies, but her hitting other kids' issues not going. So, Neha, here I would suggest, if the hitting is excessive, again, we need to do all the ABC. We need to look at the medical examination if there is a medical cause triggering it. And we need to also sometimes consider some medications which can reduce the aggressive behaviors in the child, because as the child grows up, some aggressive behaviors can continue, and those can be managed transiently with medications, and that time you use to behaviorally modify the child becomes a little calm with medication, and then the crisis is dealt, and you simultaneously work through behavioral methods to build the skill for the child, or to build a better communication, treat if there is any medical cause. Uh, that that medication will give us a tied away period to support the child, and then gradually taper the medications and get the child off without medication, and see if the hitting behavior persists or not. So here you can seek help of a professional or a doctor, like developmental pediatrician or pediatric neurologist or a child psychiatrist. Whoever, anyone can help you with adding a medication and reducing hitting. Okay. Do we have more? Okay. So we are finishing for today, but we have lots and lots of questions in the comment box. I would recommend, please fill our Google Forms, because we are putting up questions from there. From here also, we'll select questions, and we'll try and answer each of your questions. We had some repetitive questions today. What we'll do is, we'll next time squeeze out the common set of questions, and we'll pick up those and try and answer your queries, so that maximum queries get answered in each session. And thank you all for your amazing participation in our Q&A sessions, and I hope our these sessions are helpful for parents, and they're helping in solving some of their concerns and challenges that they are experiencing. And yet again, we'll come on the next Wednesday with another interesting session. See you all. Till then, good night and bye bye.